Good morning. How do you do? My name is Teresa. I'm your nursing student. I'm working with Joe, your nurse today. How do you do? Good. Good to meet you. Well, the reason I'm in your room today is that I'm going to be doing what's called a head to toe assessment. So I'm going to be listening to your heart and lungs and checking your skin. I might have you sit up. I'll pull back your covers and look at your feet. I understand you have some wounds there, so I'd like to check those out. And at the end, I'll have you turn over and I'll just check your skin out on the back. Is that okay with you? Okay, wonderful. Should take about 10 minutes. Before I begin, is it okay if I put my information down? Okay. I just noticed the hand washes. If there's any, oh, here's some more. Good. So I just wanted to wash my hands, and then so I'm doing this right in front, very visible. So before I begin, Joe, I just wanted to ask you, are you having any pain or shortness of breath? Any chest pain at all? No? Okay, great. Do you wear glasses, I see? Do you need any dentures or hearing aids before we begin? I want you at your highest level of functioning. Okay, terrific. Thank you, I appreciate it. I'm just now going to check my information to your name band. Could you please tell me your name and date of birth? Okay. And if you can't read it, make sure you just kind of spin it around. Okay, here we go. So Jane Smith. Okay, and Jane, can you tell me your date of birth, please, your birth date? Okay, and that checks out. Very good. 10/13/1919, and your medical record number 123456, 123456. And Jane, are you allergic to anything at all? Seasonal, yeah, okay. Well, hopefully we'll have a month of reprieve before the spring blossoms come. But this says no allergies as well. Okay. If there's any discrepancies, you would say I'd have to stop and check that. But everything checks out today, Jane, so I'm happy to work with you. I appreciate you letting me do that. And before we begin, I just wanted to ask you about your night. Can you tell me about your night? Okay. And then what does the therapist and Joe, your nurse, have planned? Did they let you in on that? Okay. And while you're here at the TCU, is there anything that I can do for you today? So a reference to the place, the time, and past and events. And he says everything's appropriate. He did not seem surprised I said TCU or his nurse. So he would relate some information about that. And so today you want to get out of bed? Great, I'll check your orders and make sure we could do that. I think that's a definite possibility. I see that you're off your IVs. Nothing's attached anymore. Do you have the IV over here? Okay, great. That's what I noticed, just a saline lock. Again, I would check that to my orders. Just a saline lock. How is that feeling? Okay, not bothering you at all. You still have your trach. How is that going for you? Okay. And then I noticed you have a tube connection there, your chest tube. Okay. Are you doing okay with that still? Okay. Perhaps that will be taken out soon. We'll just make sure. So when I get to that side, I'll check that too. As long as he's not in any distress. So I want to know if he's in pain or distress, shortness of breath, big three, and then I can proceed. Okay, wonderful. Do you need to use the bathroom before I begin? Okay, terrific. Okay, so you appear in a good mood and had a restful night's sleep. Wonderful, thank you. And then when I begin my assessment, I'm just going to touch your skin if that's okay. So just checking color, temperature, and neuro, and everything is intact. Do you have any history of seizures, Jane? So the checkoff asks you to do a pupil check. It's not appropriate for everyone. For kids, no. It elicits seizures, and anyone that has seizure activity or a neuro issue, no. And so I would just check pupil size initially. Okay, and then do you mind if I remove your glasses, Jane? Okay. And have them open your eyes and just do a pupil check. Good, just do direct and indirect. Good job, okay. So I noticed they're about 4 millimeters and they respond appropriately. Okay, would you like your glasses back? Thank you. All right, terrific. And then the last thing would be Jane, since I put his glasses back on, I want to just test for accommodation. So So would you look at my pen here, watching for constriction at close, and then if you look back at the end of the room and looking at his eyes for dilation. So pupils equal round, reactive to light, and accommodation. That's perfect, Jade. Thanks so much. All right, and then I'm just gonna listen to your heart and lungs now. All right, any cough that you've experienced with that trach or need for suctioning? Okay, great. All right, I'm gonna have you sit up real quick. I noticed too you have a line up here. The dressing looks good. And then it seems to be everything intact, no leaking or anything, so it's okay to touch that. And you have your med patch on. I don't see a date, but I'll check on that. And your incision looks good. I don't see any signs of infection. Is everything okay with that? Okay. So I'll have you sit forward. Wonderful. And then I'll just have you take some deep breaths, really big initially if you could, just starting at the bases, in and out. So I'm supporting him in and out. Good job. Doing a real thorough base assessment. And then each time, Joe, of course you're going to do this slower, a real patient. In and out. Wonderful. I'm not asking him any questions while I'm listening. So that's the lower lobes, upper. Great. Do you have a couple more breaths in you? Okay, I'm just going to listen to the sides. So his left side has 2, lower, upper. If I needed to go around, I do have that bandage. I could walk around upper. And then you don't want to listen over a bandage, so I would have to go around and get that one. Okay, if you're okay to still sit up, Joe, or excuse me, Jane, I'm going to just listen to your breathing in the front. And then you kind of just have to go around whatever's here. Listening either side. And now I can kind of get that lateral here on that left. Sorry, I'm right in front of your vision. And then this side. Good job. All done with breathing, so I did posterior, lateral, anterior. Everything sounds nice and clear. Appreciate that. So now we can sit back. Notice I didn't really address the skin because I'm focused on breathing. Okay, now Jane, I'm just going to listen to your heart. Is it okay if I keep your shirt down? Okay. So I'm just going to tell you what I'm listening for. Second intercostal space, right sternal border, aortic valve, and it's S2. And it does have that patch there, but I'll be able to hear right over it. So second intercostal space, left sternal border, pulmonic valve, S2. Go down to third intercostal space, left sternal border, Erb's point, just murmurs. I don't hear any murmurs. I'm going to skip fourth. I'm going to go to fifth intercostal space, still on that left sternal border, and tricuspid, and S1, and then 3 and 4 if his heart was really vibrating. And then we'll go down to still on that left, fifth intercostal space, midclavicular line, and mitral valve, S1, 3, 4. Point of maximal impulse, also they listening for a full minute if you're on a rhythm regulator med. Okay, now I'm just going to listen to my valve, aortic, pulmonic, Erb's point, tricuspid, mitral. Fantastic. Everything sounds great. While I was listening, I noticed his breathing was regular, even, ease, no audibles, no distress, equal rise and fall, no concerns about that, and he said he wasn't short of breath. While I have my stethoscope, I'm just going to listen to your abdomen. Got some tubes down here. Okay, everything treating you okay there? Okay, so I notice you do have a couple of moles here that they've been an issue for you. Okay, is it okay if I pull your drawers down? Okay, so you have the 3, 2 on either side and 1 in the center. Okay, I'm just going to listen first and then I'll ask you questions. So right lower, right upper, left upper, left lower. 5 to 30 is normal, and I hear ball sounds in each quadrant. As soon as I hear, I can move. Okay, all done with my stethoscope, and now I'm just going to lightly press. I should have said, I'm going to lightly press on your abdomen. Any pain or tenderness, let me know. Okay, now press. I'm watching him. Her. Good job. That's it. If I had a concern, I could listen to those arteries, so aortic, renal, iliac, femoral on either side, going down. Okay, Everything sounds great. I want to ask about intake and output. So how's your appetite been, and how is how much have you been eating? So two different things really. Does he taste and enjoy food? Does he feel like eating, and how much is he eating? And then intake for fluids. So are you drinking enough? Okay. And then output, last BM, any problems with stool, constipation, diarrhea? Okay. Button him back up. Great. If I would check pad, ask about incontinence. Okay. And then before I proceed down to your feet, I'm just going to check temperature, texture, turgor. Just one hand is enough. Cap refill, less than 2 seconds. Great. And then are you okay to squeeze my hands? Great. Lift. If you could close your eyes real quick, what finger am I touching? How about now? Okay, open your eyes. Any numbness or tingling when you do this? How about at any other time? Okay, great. I'm gonna check a pulse while I'm here, radial pulse. Did palpate that site and everything looks great. Okay, fantastic. Now I'm just gonna move down to your legs. Strength was a grip. You could also do the make a muscle kind of grip. I'm just gonna uncover your feet. Joe, I understand you've got a few wounds down here. Can you tell me about those? I notice it's the great toe, second toe, third toe. I also notice you have an open area here. I do have my gloves. I can put my gloves on and assess. I would not check cap refill on those, but I could check it here, less than 2 seconds here. I'm gonna ask you which toe I'm touching now. If you could close your eyes. How about this one? And then how about now? Okay, wanna really get down and check that, the heels here, and then estimate. So it's about 1 inch long by, I say 1.5 inches long probably. It's open, it looks like it's already down to a stage 3. So we'd wanna get that elevated too. So from here, dorsalis pedis, posterior tibial, press and release on a bone for edema, checking that calf for warmth, looking for redness, any problems or pain with your calves? Okay, and then I would feel here, I did see in this chart you did have a wound here, so I'm just kind of feeling up on the side. I normally wouldn't do that, but I did notice that, and you tell me about that and I can have a look at that. Okay, the other side as well. So whatever you do on one side, you want to do the other. And then the last thing, Jane, I'm just gonna check your skin out on your back, okay? Any problems that you have, any incontinence, any issues sliding up under that heel, okay? So then you assist them, side rail up, have them roll over best you can. And so roll, grab that side rail, and then you're really just checking everything. Ears, scapula, bony prominences, edema, if they're incontinent, any stain on the bed, and then heels and side. Of course, I could get a better look at that leg. All right, have you roll back, Jane. Thank you so much. Assist you to get up a little bit. Any concerns that you have other than getting out of bed? Okay, wonderful. Well, that concludes my assessment. I'll be with your nurse